Hello, 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 hello. We're back on Radio Control 99.4. That was Ghost Town by 47 Soul. And today we're going to talk about the healthcare crisis in Aotearoa, New Zealand. So basically the issue today, the first issue that is that there are growing concerns about whether the health system can cope with demand. Wait times for treatment and diagnostics, staff shortages, infrastructure limitations are recurring complaints. The affordability of healthcare is also seen as problematic for many. So here are the core issues. We're just gonna talk about these, and then we're going to have some points of debate, and then hopefully come to some kind of a resolution. And yeah, if anyone has anything to add, feel free to call in 06-350-4994 or give us a text 022-350-4994. Okay, so today, the first of the core issues is that there are unacceptable wait times. So elective surgeries, diagnostics like MRI and cancer screenings, and GP appointments face weeks to months of delay. And in some DHBs, even urgent cases wait longer than clinically safe timeframes. So that's not good, and we need to fix that, right? Yeah, I think we do. Okay, that's enough of that. We have a staffing crisis. There are over 4,000 nursing vacancies, with rural hospitals particularly affected. New Zealand trained doctors and nurses are leaving for better pay and conditions in Australia, and we don't blame them for it. But why aren't we making things better here? I don't know, right? Okay, and that's enough of that. And mental health services are chronically short-staffed, leading to major access problems. And yeah, I know that there are many people out there that need help, and if they're not getting it, where else are they going to get it, right? We don't want them on the street. We want them in the right place. We want them getting the help that they need, right? Okay. And the next issue on the growing concern about the health system is that there is a two-tier system emerging. So there is those with private insurance or savings, they skip the queues. Those without, they're left waiting or deteriorating, and this undermines the universal care ethos of New Zealand's public system. So yeah, we want the sick person to be treated just the same as the person who has money, right? I mean, if we are leaving the sick person without money to die, we're not doing our duty as a state, as a nation, or as a people. So we need to fix this, and that's enough of that. So the next issue is that our infrastructure is outdated or overloaded. So facilities in many regions, for example Northland, South Auckland, are in poor condition. Some hospitals still rely on paper records, outdated diagnostics, or single staff members managing whole departments. And yeah, I know what this is like, and it is not good. It is at its breaking point. So there needs to be some kind of a change, and I'm telling you from experience, there needs to be some kind of a change there. Otherwise, what on earth are we doing with our taxpayer money? Yeah, that's all I have to say. And the last issue, cost barriers are rising. So many delay or skip treatment due to co-pay fees at GPs, travel costs, or prescription fees, even at $5 or $10. These small barriers compound for low-income families, Māori, Pacifica, and the rural whānau, making it an equity issue as much as an economic one, right? So when we need to get healthcare, we shouldn't have to worry about the cost, especially in a state like New Zealand. We should all receive the appropriate care. Otherwise, we're not doing our duty as a state. Okay, so the points of debate, and I have a couple for you, and I have yeah, I'm just gonna throw them out there, and then we'll see what we can come up with. So the first point of debate: just spend more money. So New Zealand already spends 9.7% roughly of GDP on health, a significant amount, yet results are slipping. Money alone without structural reform is not enough. Misallocation, inefficiency, and bureaucratic bloat waste precious resources. So we need to not only allocate the money, we need to allocate it properly. Because if it's not done properly, we can just be putting money into the bin, and we don't want to do that, do we? Okay, and the next point of debate is privatize more services to reduce pressure. And basically, this fuels the two-tier system. Private providers poach public staff and cherry-pick profitable services. This weakens public delivery, especially in rural and poor communities where the private sector won't go. So, yeah, we don't want to be like America, where you have to pay for your health. We want to actually provide it as a state. At least that's the New Zealand that I know of, and I don't think that that's the right way to go. So that's enough from me. Another point of debate: train more people locally. Yes, but this takes years, and unless pay, working conditions, and workloads are improved, we'll keep training for export. So we'll keep training for export, sending our nurses and our doctors straight to Australia, the UK, or Canada. So we need to improve working conditions, especially, and workloads, and then pay as well. So that's that. And the last point of debate: immigration can solve staff shortages. Yes, partially. We do need skilled migrants, but over-relying on them displaces the need to fix retention and burnout issues at home. It is also ethically fraught when we poach doctors from lower income nations. So yeah, I mean, we don't want to do that. We want to solve the problem of a healthcare system that is overloaded. And yeah, we need to do it right. So that's all I want to say. And the resolution, what we actually need to do. So one resolution is emergency pay and staffing package, a short-term retention and recovery fund to stop the outflow of nurses and specialists, bonus pay and improved rostering to address burnout, prioritize rural, Māori, Pacifica, and mental health workforce funding. Yes, 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 I agree with all of these things as resolutions. So that's the first one, emergency pay and staffing package. The next resolution, surgical and diagnostic surge plan. So a national task force, like the COVID vax teams, to blitz the surgical and scan backlogs with mobile clinics, extended hours, and contracted private capacity, only where needed. So, if we could have rolled out the COVID vax as we did, why can't we do that to address our actual problems? Because to me, the COVID vax thing was what's the word? Autocratical, and no one had a choice in it. Yet everyone had to get it done, and it was done so quickly. Why can't we use this as a model to actually address the problems that we really have, such as hips, knees, cataracts, cancers, and cardiac diagnostics, right? And if you see my logic, that it's already been done for one issue, why can't we do that for another issue, right? Okay, that's my point. So I hope you can understand what I'm saying. And the next resolution, accelerate infrastructure renewal, fast-track upgrades in the 10 most under-resourced hospital districts, not just the flashiest urban ones, digitalize records, expand telehealth and rural diagnostics, and public-private partnerships only if equity rules are followed. Yes, this is the right way, and I agree with it. So another resolution, make healthcare cheaper for the public, fully free GP visits for under 18s and over 65s and low-income earners, cap co-pays for everyone else, for example, $20 max to see a GP. I mean, we shouldn't put off seeing our GP if we can't afford it. That's all I have to say. We live in a country that can afford to support its sick. Otherwise, what on earth are we doing? I don't know. I really don't. I'm just speaking from experience and from a point of necessity here. And free prescriptions for all basic medicines, as done during COVID, proven effective, right? So free prescriptions for all basic medicines. That could really take the burden off the general public, right? And we need it. We do need it. Okay. And I'll leave it at that. And the last point is train and retain the health workforce. So bonded scholarships for doctors, nurses, and psychologists in underserved areas is the first point. Create fast-track return to practice programs for retired or semi-retired clinicians. Yes, I agree, because it would be a shame to see those who still have the skills to not use them in the role that they are trained to, especially when we are so short of clinicians in this country, right? Okay. And finally, clear and funded pathway for nurse practitioners and advanced roles to grow workforce capacity. Yes, I agree. Okay, and a final word, Aotearoa's healthcare system can be repaired, but half measures, ideology wars, and bureaucratic tinkering won't cut it. We need to, we need to do something about it, and I've hopefully explained it in a way that everyone can understand. So that's the first issue for today, the issue of a healthcare system that is overloaded. And yeah, hopefully this turns into some kind of positive action in the healthcare sector. So I'll play some more music for you coming up. This next one is by Esther, or Esteri, might not be English. Esteri, a New Zealand artist, and the name of the song is called Wingspan. You're listening to Radio Control 99.4 FM with Dan. We'll have some more news for you up on the hour with the sport and the weather. And yeah, enjoy the show. You're listening to Control 99.4 FM.